because your chest x-ray is not normal does not mean that you have lung cancer. Chest x-rays are actually pretty blunt instruments. They can suggest that something is there, but they often can't tell us exactly what we're looking at. That's why if your chest x-ray raises concern for a lung nodule, the next step is usually a CT chest. That CT scan of your chest is going to tell us whether there is actually a nodule there, what is the size of the nodule, its location, and whether there are any features of that nodule that may be concerning for malignancy or not. Often, if it seems benign, we may actually choose to monitor that nodule. And remember, we don't just treat the scan. We also consider you, your age, smoking history, environmental exposures, and other risk factors before deciding what to do next. Can a lung nodule actually disappear? Yes, and that's actually one reason we don't rush every patient into a biopsy or surgery. Some nodules are caused by infection, inflammation, or even mucus plugging, and they can resolve over time. That's exactly why follow-up CT scans are so important. They help us see how a nodule behaves before making major decisions. One of the most common things that I evaluate as a pulmonologist is called a lung nodule. A lung nodule is a small spot that shows up on the CT scan of your lungs. They're actually very common and most are benign, meaning not cancer. But depending on the size of the nodule, shape, location, and patient's risk factors, we sometimes monitor the nodules over time with repeat imaging. The key is to make sure they're evaluated appropriately. When someone comes in with a lung nodule, I generally order a pulmonary function test or a PFT. I do the pulmonary function test to tee you up in the event if your biopsy is positive for cancer, then we'll know if you're a candidate for surgical resection or not. Then order either a repeat CT scan, or if the nodule is big enough to biopsy, meaning more than 8 millimeters in a high-risk patient, then we would most likely proceed to a biopsy. In certain special cases, I would do something called a PET scan, PET scan, where different things light up in your body. There are many different ways to obtain a lung biopsy, and we will discuss all those options in the office if the time comes for that. Having a lung nodule that is in question is never fun. I get this question a lot. Why not just remove the nodule? If it's there, just take it out, right? Here's the thing. Surgery isn't risk-free. Every operation carries potential complications, and many small nodules turn out to be completely benign. If the chance of cancer is low, carefully monitoring the nodule may actually be the safer option. Sometimes the best medical decision is avoiding an unnecessary operation. Did you know that some lung nodules can be caused by a fungus called coccidioides? We live in Nevada, and I practice in Arizona for the last 6 years. The best case scenario, if someone had a lung nodule, we could biopsy it and find out that it's not cancer and it's instead a fungus that we can treat. That's one of my favorite things about living in this area. A lot of our lung nodules that we find turn out not to be malignant at all. So, what is valley fever? Valley fever, or coccidiomycosis, is an infectious disease caused by inhaling the spores. In the US, the fungus coccidioides lives in the soil in Arizona, Nevada, California, and New Mexico. Coccidiomycosis is caused by inhaling the spores of the Coccidioides immitis fungus. It lives in the soil. So if you're like walking down the street and the dusty air is blowing in your face, you can inhale these spores. And if your lungs are susceptible to it, you can get a lung nodule or a lung cavity or just the symptoms of valley fever. Won't a biopsy actually spread the cancer? I have had so many patients ask me this. Biopsies do not cause cancer to spread. Fortunately, with modern biopsy techniques, that complication is extraordinarily rare. We biopsy lung nodules because the pathology tells us exactly what we're treating. That information guides every decision that comes next. I know there's a lot of fear out there about lung nodules and getting biopsies and whether it's safe or not, and there's so much uncertainty and misinformation, so I hope that my information here is useful to you. I'm Dr. Charran, a pulmonologist here in Las Vegas. If you are trying to understand a lung nodule diagnosis, follow along. I'm answering questions I hear every day from patients.